Hello, and welcome to Lessons Learned from SARS, How Museums Emerge After Crisis. I'm Elizabeth Merritt, Vice President of Strategic Foresight and Founding Director of the Center for the Future of Museums at the American Alliance of Museums, and I will be your moderator today. There's a saying that the best predictor of the future is the past. That quote's been attributed to all sorts of different people, including Mark Twain, but whoever said it was spot on. As a futurist, I appreciate that what we learn from history can help us respond more quickly and more wisely to the challenges of the present. Of course, right now, many museums are facing the prospect of extended closures and profound financial damage due to the COVID-19 pandemic. Museums face difficult decisions about when and how to reopen, and once they are open, how to reassure the public that it's safe to visit again. Ontario museums faced both those challenges almost 20 years ago due to two separate events, the outbreak of the SARS virus and a public service strike that lasted over 2 months. Today, you'll be hearing from 3 women who helped guide the Ontario Science Centre through those trying times. Our panelists today are Lesley Lewis, who served as the CEO of the Science Centre at the time, Julie Bowen, who was the center's Associate Vice President for Design and Development, and Jennifer Martin, VP of Visitor Experience. But before I hand the presentation over to our speakers, let me cover a few logistics of this webinar. I'd like you to locate 2 buttons in your Zoom webinar menu. One is for chat and one is labeled Q&A. If you click on chat, it will open a chat window. And if you click on the message square, you'll have the choice of directing your chat message to either all attendees or just to presenters. If you're having technical problems, if you're having trouble with sound or connectivity, please send a chat message to just the presenters, and my colleague, Anthony Hovington, will try and help you resolve your issues. I'll be using the chat window during the presentation to share a few links to resources that are being mentioned by our panelists today. You can use chat directed to all attendees to share links or resources as well, or make comments. Now, we are going to allow a generous amount of time for discussion and Q&A after the formal presentation. So please use the Q&A window to submit questions to our presenters. I'll be monitoring that while they speak. With so many attendees today, our panelists may not be able to respond to all of your questions, but if that's the case, we'll see if we can tackle some of the issues you raised in a guest post on the Alliance blogs as we follow up. Last note, we do have closed captioning available on your menu bar if you want to select that, and we'll publish a transcript of the webinar together with video. Now, without further ado, I'm going to turn the screen over to our panelists to introduce themselves at more length.
So I'm Jennifer Martin. Julie's just pulling up our presentation, and I'll be starting things off here. As Elizabeth has said, we 3 worked together at the Ontario Science Centre for a number of years. I reported to Lesley, Julie reported to me. There are a number of circumstances that we want to bring your attention to while we're talking about all of this. But let's do intros a little bit deeper. Julie, if you want to go to the next slide, please. So as Elizabeth has said, Julie was our VP, Associate VP for Design and Development, and I'll talk a little bit more about the situation of work that we were going through. Lesley as our CEO, and I was our Director of Visitor Experience. What doesn't show on here, although you can see that none of us are currently in an institution, is that Julie and I further worked together at TELUS Spark in Calgary, the Science Centre here, and then she went on to work at the Museum of Nature in Ottawa as well. So Julie, if you want to flip again. So in general, these are the major questions that we wanted to address today. They're the things that have been surfacing in conversations that we've had with our colleagues, certainly things that we've heard Elizabeth filter as well coming through the AAM. We're going to give you a very brief overview on some of the key lessons that we took away. So major statements of learning and understanding on each of these questions. But we feel that many of the details of how we came to those lessons will arise through the Q&A and the questions that you bring to us. So we're not going to go deep in the first 20 minutes or so into the whole story. We want to give you a context for this and again, focus on those lessons. So Julie, to context. So this is the Ontario Science Centre. The data you see here is as of 2003, what was going on with us. Annual attendance at that time, about 1,350,000 people. The budget of $30 million, you can see, has about a 45% grant, an operating grant from the government of Ontario. So it's a government agency, and then we realize that that's probably quite different from many of the circumstances that you work in. And it did provide us some cushion. There is no question about that. But many of the lessons still, I think, ring true to everybody's situation. The Science Centre was opened in 1969 and has gone through a couple of major renovations, in particular that 2003 to 2006. That happened right as we were started, anyways, as we were in the throes of SARS and moved forward. That capital renewal campaign, it was about a $47 million program, had started in 2001. And our focus on innovation and responsiveness actually became quite helpful, if you will, and something to think about in our lessons going forward in how we responded by being prepared to be responsive. So I'm going to pass this over now to Lesley to go a little deeper into what was happening to us with SARS at the time.
So in 2003, towards the end of March, a state of emergency was declared in Toronto. SARS had actually arrived in Toronto at the end of February. Compared to the current COVID-19, the numbers look minuscule. SARS worldwide, there were 8,000 cases in total and about 774 deaths. So you contrast that to what we're seeing today. In Ontario, we're talking 438 cases and 43 deaths. So it was very small by comparison, but still sufficient to declare a state of emergency. But what didn't happen is that the Ontario Science Centre never closed, and nor did any other institutions. We were the epicenter in Toronto of SARS outside Asia. There was a major economic impact in Toronto of about $2 billion. 25,000 people were quarantined. There were employment losses, particularly in the tourism sector. There was some evidence of racism and discrimination. SARS had originated or was thought to originate in China, and certainly businesses, particularly hospitality businesses owned by members of the Chinese community or experienced some discrimination. And one of the things we've been all hearing about recently is the idea of 2 waves of infection, and we certainly experienced that. February to April, there was some community spread. The second wave of SARS was May and June, which was strictly in healthcare institutions. But overall, what we had is 14 weeks of an acute public health event. So what did that do to the Ontario Science Centre's attendance? As I say, we never closed, but almost overnight, we saw our attendance drop. So in the April to June period, our attendance was off 44% from the average. July to September, it was still off 29%, although that was very influenced by a 5-day blackout that affected many US states and Ontario, caused by a power surge. I think it was out of Ohio in August. So it's possible that July to September might have only been down about 24%. But then look what happens in October, up 19% over previous years. And the following January to March, still up 8%. one of the things I'm going to be talking about in a later slide is a key element of the Toronto-wide recovery experience, and that's something called the Toronto 03 Alliance. And it's an example of how we were able to bounce back in Toronto by many different organizations working together. But as we were preparing for this, Jennifer and Julie and I were very aware that our response to SARS and the way it impacted the Ontario Science Centre is really different from what's happening now when institutions are all closed. And so it reminded us of our experience just 1 year earlier when we closed for an unknown period of time. In March of 2002, the public service was working towards a strike, and the Ontario Science Centre is a public service institution. In fact, we were told on a Wednesday night that the strike would start at midnight that night. It was March break, and the next day we were expecting about 14,000 visitors in the building. And we closed, and it ended up, the closure lasted more than 8 weeks. A couple of key things there that will again make this different from the current situation is that there was almost an immediate recovery in attendance because there was a pent-up demand to come to the Science Centre. And important to note that before we opened to the public after the strike was over, we had 3 days of staff back at work so that we could rebuild ourselves as a team. And I think, next slide, Julie. I think it's over to you now.
Great, thanks, Lesley. So as we've sort of said, there's sort of 3 things that we want to talk about with respect to thinking about how to imagine reopening your museums, how to restart an organization, as well as what the financial impacts might be. So from the provincial strike in 2002, there are a couple things that seem very salient to planting in your heads to think about as you plan reopening. One is that people are going to be coming back from, both your audience and your staff are going to be coming back from time off in different ways. And so assuming you're also potentially changing some of your processes, it's a great opportunity to think about what those look like. How do you help people to know how to be in the organization when you reopen? And what happened after the strike was there's a lot of anxiety, a lot of emotional context that we needed to think about. And so having a few days prior to opening to the public so that your staff can get to know each other again, can start to understand the norms. You may have opportunities. You're maybe rehiring, you may have lost people along the way. And so recognizing that this is something that you are going to have to come to terms with as an organization from an emotional standpoint is an important piece. By giving people that time to think about where they are now, where they've come from, those pieces are going to be really important in building and rebuilding the resilience of your organization. And that will reflect back into your staff or back into your audience. So one of the things that we learned, not just from the strike, but also from SARS, was that there were many people with symptoms of PTSD who were coming back into the workforce. So this is particularly important as you think about that. There are going to be people who are sad, who are grieving either changes, or they may have lost people. You may have lost staff as you've downsized. And so there's stress, there's an ongoing level of anxiety. How do you help people to come back to that? And so giving yourselves time not to just sort of open and move quickly into the new phase of being a museum open to the public, give yourself time to think about that. And that really helped us to rebuild some of the relationships between those who were on the strike line and those who were management and those who decided to not be on the strike line. Also, if remembering that you, as some of you as leaders, have been in the thick of things. You've been living this return to work. You're excited about people coming back. to be back in step with them, bringing them along rather than sort of jumping into, we're ready to go and let's get moving and let's do something. So there we go. One of the other pieces here in terms of thinking about SARS and what the lessons were from that is that there was a behavior change that had to happen for visitors. Because SARS was also transmitted by touch and by people's droplets and all that, we had to rethink how to be very open about keeping the exhibits and the visitors safe. And so that made it really important to shift the timing of when we did the cleaning of exhibits so that it was visibly happening when visitors were on the floor. This was back before hand washing stations were sort of ubiquitous. And so putting those right into the midst of the exhibit halls everywhere, in fact, everywhere you turned around, helped to normalize the experience and sort of recognize the social safety nets. I mean, there's lots of things to consider here, how comfortable people will be using hands-on experiences, how comfortable people will be being close to each other. And so thinking in terms of, again, lessons from SARS and some of the other experiences that we've had, time tickets, opportunities for people to be limited in numbers in the space. We've done that for a lot of our children's exhibits, and so that's something to consider as well. The other thing is that people may return at different rates. This is something we saw with the SARS experience, that members came back fast. The school groups came back next because there was a pent-up demand. And tourism, and Lesley will probably talk about this more, tourism to the city took a long time to come back because Toronto became synonymous with a place that was potentially still contagious in some way. And so it took several years for the tourism industry to rebound in the city. The other thing I wanted to mention here was thinking about how you bring your audience back is being responsive to what you're hearing them say now, if you have members and you're able to speak with them, as well as what they're doing when they do return. And so being quick off the mark to change what you provide or operate differently, or to see that you may have a new audience and then to develop more there. So Lesley, I'm going to switch it back to you to talk more about the new alliances.
I'm going to talk briefly about two different alliances. One was an alliance that already existed, which was called the G7, which was an alliance of the major cultural attractions within Toronto, which had really been started in about early 2002. And to a certain extent, it came into its own in 2003 as everybody was trying to rebound from SARS. And there started to be far more coordination of activities, working together so you had museum, art gallery, science center, and the zoo all working together and trying to solve very similar problems. The other was a citywide alliance called Toronto 03. And it was basically developed to promote travel to Toronto, because in the middle of SARS, the WHO issued a no travel warning for people to warn them away from coming to Toronto. That's what had led to the precipitous drop in tourism. And so the people who formed the Toronto 03 Alliance were made up of representatives from business, the arts and entertainment, tourism, restaurant, hotels, and government. It was an unprecedented alliance in Toronto. I was fortunate enough to be asked to join the board of that, probably because the Ontario Science Centre had had the largest reduction in its attendance among all the cultural institutions. And Elizabeth, you may want to drop in that case study now so that people can see it and have the link. The Toronto 03 Alliance got funding about $10 million from the federal government and about $1.2 million from the private sector. And basically what happened is that through a variety of initiatives, the Alliance packaged the summer. So we really worked hard to put together things that would make it irresistible to come to Toronto starting in late June. It reinforced existing things, so exhibitions that were already planned for the Ontario Science Centre got a higher profile. It also created some really high profile significant events. So the Rolling Stones came and did a special public concert. As an aside, when I was reminding myself of it today, something like 47,000 Americans came to that concert, which I hadn't remembered. There was also a lot of branding of Toronto that went on, or rebranding. Now, as Julie said, it took a while for tourism to come back, but the analysis seems to indicate that because of the activity of Toronto 03, tourism did revive faster than had been expected. So the lesson from that, as Julie said, is it's really important to build new alliances right across the community, not just with the people that you've previously had alliances with, because with something like COVID-19, everybody is hurting. Everybody needs to get it back. And so work with them, and you could find alliances that you've never had before that will become very deep partnerships moving forward. Next page. I think that's you, Julie, again.
So I think the other, just to reemphasize a couple of points, to recover financially, your members and your supporters want you to recover. And that's obviously a sort of a statement to consider as you start to keep in touch with the folks that are important to you. We also, after SARS, we looked at what could we open, what was on the docket, and how would that help to draw different audiences back in. And we opened an exhibition called Kids Park, which was for children 8 and under and their caregivers. And what we found when we opened that fairly quickly was that it was a pent-up demand in the city, and that we were having huge lineups of people wanting to get into that space. Because of what we had gone through, both in the strike and in SARS, and because we were looking through this sort of major redevelopment plan, we were able to refocus and double the size of that experience within a very short period of time, so that we could help people to do what they wanted to do in the building. And so being in a situation where your culture is resilient and creative and innovative will help you to respond to whatever happens, I think, in your community, in your particular situation. The other piece of sort of advice or thing that we'd like to say is that it's really important, in particular for those of you who have community partners, either right now or that are potential community partners that you've been working with or wanting to work with, make sure that those folks are still there or are capable of still being there when you reopen. So they may need your help to survive. And I know that that's a hard thing to sort of add to the burden of all of the things you're trying to juggle right now in your institutions. If those people are not able to survive this, then you've lost something really rich within your community. And I think that's something to just bear in mind. It's one of those pieces that are really critical. Another example that I wanted to throw out as you start to think about your institutions and the value you can have when you reopen or now to your communities, is to think about all of the things that your community is going through right now. Again, back to those psychosocial impacts that we saw in SARS and we saw in the strike that ripple through the community in ways that you don't necessarily recognize right away. There's loss of income and employment that happened in SARS as well. Social isolation for people, fear, anxiety, all of those things. And so I was reminded of what one of the botanical gardens did at a point of turmoil in the US, was to open their grove to people just to come and sit and be in the space and reconnect to nature. So thinking easily about, or thinking gently about what you can do both now and in the future, not only as you restart, but as you are in your community, I think is something that we learned from both of those experiences.
If I can just add one thing to that, Julie, I remember that one of the things we did after SARS was no longer rampant in the healthcare system as well, is that any frontline healthcare workers, whether they were paramedics, doctors, nurses, people working in the labs, all they had to do is show their healthcare ID and they would be admitted free to the Ontario Science Centre with their family. And we continued that, I think, for about a 6-month period as a way of saying thank you to that community.
So I'm tasked with closing this part of our conversation, and I have a big dog beside me, so if you hear him, sorry. We want to also just reflect on the fact that we're 3 Canadians speaking to you today. And we know that there are slight differences in the conversation that are going on between the 2 countries. So we'll try to be sensitive to that. And because we have a very unique perspective on what happens in the US, simply because of the media and the kind of exposure that we have, that's just a little bit different. And I wanted to finish with just reemphasizing something that Julie said about what role your museum or science center can play. It's a time to really think about what we are uniquely good at, and it's not always the stuff that's on the front or the surface of our work. That there are things that we can bring to the table that might be a little bit different. And I think some of the questions that will come up in the next little while about speaking about science in all of this would speak to that. So think about what your unique role is in the community as we go into some of the questions. So I think, Julie, we're going to drop your share and just go to us live. Great. Okay, Elizabeth.
Yes, first of all, I wanted to let you know I did drop in the link to the civic action case study. I have 2 more links that I'll drop in now. If you could just tell our attendees what these link to, so they'll know what they're looking at. One is for the archives.gov and one is the health services reports.
So one is the commission report that was done on SARS, the interim report, which has a lot of really useful and interesting information in it. And the second is a sort of report on what happened within the public health sector and the community there, if you're interested in digging into those at all. Excellent.
We have a number of questions coming in from our attendees, so let me start feeding some of them to you, okay? So Sarah Sims writes, I'm wondering if you could go deeper into what those days where staff were back but you were still closed to the public looked like. What did you do? Were there large or small meetings? Was it pretty structured or more free form? Were there trainings that were needed?
You know, I could start a little bit on that because I'm probably at the furthest edge of being sensitive to the needs of change like that. And Julie and I've worked well together because she picks up that thing that I'm not so good at. My tendency is to get back to work. Okay, we're all here. We all know what to do. Let's get at it. And it was really a lack of appreciation for, again, that point. I, as a manager, was already on site. I was ready to get back into it. That reacclimatization for everybody at a physical level, and even dropping all the way down to what does it take to start and restart? Because operating day to day is one level of momentum. Having to restart all of your work is a quite different thing.
I'm going to approach this from a somewhat different perspective in terms of what the possibilities are today with the various forms of media we've got available. One of the hardest things, I think, during the strike was maintaining relationships when something like 300 of our staff were on a picket line and 40 of us were in the building and maintaining the building and trying to plan and answer questions from our board, et cetera, when we actually couldn't control the strike. And at that time, a lot of us used to go out, a lot of management used to go out, and we used to actually walk on the picket line every day for about 20 minutes, which one wasn't supposed to do, but it was a way of maintaining relationships. But I'm aware today that there are many people who are harnessing Zoom or some other channels. So one museum I'm aware of in Australia, what they're doing once a week is trying to keep alive the friendship that there is among the staff. So they have a Zoom meeting once a week where everybody gets together for a drink. And they say, in normal circumstances, they might be going to the pub together, but that's not an option. So what they do, they get together about 6 o'clock in the evening on Zoom with a drink, and they're not talking about work. They're talking about each other and their families and their dogs and their cats. And they're trying to maintain that sense of esprit de corps among the staff group. And I think that's great. That's a new way of being able to walk the picket line.
Thank you for that.
So I'm just going to add one last thing to that. There's, when we returned to work from the strike, there was a lot of relationships that needed to be rebuilt to some degree. People who had chosen to not walk the picket line, but still were union members, and people who had walked the line every day. And so having ways to sort of rebuild those relationships took a long time, and they took was slow to get there. And so being a manager and being aware of those things and trying to mediate some of those conversations. So the analogy would be, or the comparable might be, as you bring people back who were furloughed or laid off to people who have been paid through the course of this, there's different levels of time people are going to need to get back to a trust. More important, it's going to take time to be creative again, because you've potentially had lots of other drama and trauma that have been going on in your lives. And so thinking through how to do that, how to be welcoming and gentle, how to provide people with resources that you may not have imagined you needed to. Celebrating the return with a breakfast, I think, was something that we did after one of the strikes. Walking around and meeting with people. There was also a remembering of the work that you were doing and an opportunity to rethink some of the processes you do it by. And so there's a great moment now to think about, are there processes that don't really work for you currently in your institution that you have a chance to change now because you have some time, or that you may need to change because of the way people are going to visit. That could be going to online ticketing only, or time ticketing, or whatever it is, but you've now got opportunities to think through that.
Thank you. Let me feed you another question coming in from Amanda. She asks, were schools closed like they are now back during SARS? I don't believe they were, at least not in the USA. So that makes me wonder if school groups coming back will happen in the same way this time around.
Schools were not closed. And just as a reminder, because I checked this morning, there were actually only 3 cases of SARS in the US in 2003. I looked at a CDC report. So, but no, schools did not close. Nothing closed in Toronto for SARS.
But one of the things that happened with school behavior was that they stopped field trips. So they didn't come. Which I think might have caused some of that big bump that we saw the next fall. Was they've been held back from doing something, which is something to think about, how different audiences are responding to that containment or constraint, and how the elastic response might affect attendance for us later.
Great. Here's a question about HR policies. I'm wondering if there were any changes, temporary or long-term, to HR policies. You mentioned many of your staff came back exhibiting signs of PTSD. Did Human Resources provide additional paid time off or other benefits? Also, with SARS being so easily spread like COVID-19, were there new restrictions on how staff were to take and come back from sick time? But I think, as you mentioned, Lesley, SARS wasn't necessarily as easily spread as COVID.
No, and to my knowledge, we had no cases. I didn't know anyone who contracted SARS, and I am quite sure that none of our staff did. As I said, the total in Toronto was about 800 cases. So 800, is that what I said? No,
I think the other thing,
38 cases. So no, but there were some changes. And one of the things we did actually, we had a pretty robust system of staff benefits. Again, we're a unionized shop and we're part of government. So there was always counseling available, which you could access through HR. The other thing we did after the strike, and it would be great if people were able to afford to do this, we put in place something that if somebody was really stretched for cash, we gave them an advance on their paychecks that they could then pay back over a period of, I think it was 4 months. But we knew that people had really suffered because they hadn't been paid.
That's very interesting. I had not heard of that happening before. We have a cluster of questions that I'm going to lump together with people asking whether you made adaptations to your touch-based exhibits, either in terms of them being open or closed, or special adaptations or sanitation procedures from risk of contagion.
well, we mentioned that we made cleaning more visible. So that's a big part of it. We always feel, I think in our institutions, that we're doing a good job, doing the best we can with the resources we have, but it's one of those things that's invisible and you need to make quite visible. So that was a big part of it. I do know, and I just saw Whitney Owens pop on with a note, that places like Cincinnati had already started to do that at the Cincinnati Museum Center in their children's area. Take all the little balls out of the way. Like when you've got small things with lots of surface area, you're going to have to reduce some of those points of contact. So yes, it is limiting the visitor experience, but it's a very good reason for doing that. And I think that also adds to a sense of confidence that our guests will have.
Great. So another set of questions I'm going to lump are regarding social distancing, to the extent that that was a thing during SARS. So did you talk about limiting daily attendance or encouraging people to maintain an appropriate distance? Did that affect your attendance? Someone's asking about what beyond timed tickets you did for guests to make them feel comfortable.
I don't think I ever heard of the concept of social distancing until 5-6 weeks ago, something like that. Other than I've done some work in Hong Kong, and I am aware that no, that's really more around masks. I've never been aware of social distancing there. So no, we didn't talk about social distancing during SARS.
We did see some visitors wearing masks as a personal choice. But again, I think the microcosm of SARS and the differences between SARS and COVID are the numbers of people and the sort of response that's happened to that. And so I think social distancing was playing out a little bit in how we managed the numbers of people in the area for little kids. And that was really because the experience degraded so much if there were too many people in the space. And that there were a lot of moving parts. So having an opportunity to clean some of those regularly became important. I think all of that just starts to become a conversation you need to have, given whatever comfort level your community has with this stuff.
So it relates to a conversation I had on a different level this morning about density of our exhibits. And we know through the work that Colleen Dillenschneider has been putting forward that, and it's logical that people will return to outdoor spaces like aquariums and parks first, art museums being less touch and more flow. So when we get into museums and science centers where the density is tighter, we might want to look at moving some things away. We might want to look at shifting to accommodate that. That's something that as exhibit developers is usually anathema because we want lots of points of contact. But I think that the social response to having more distance is going to also allow us, notwithstanding that we should do this. So those two things may come together quite well.
Interesting. Catherine asks, can you talk more about the Alliance and specific examples of how you encouraged people to come back to your museum? How did organizations work together? Was it joint events or just opening at the same time, or joint marketing?
It was a combination of a whole lot of different things. One of the main organizing points of the Toronto 3 Alliance was we capitalized, and I cannot remember what the very popular show was at the time, but the major live theater venue in Toronto, which is run by the Mirvish organization, they developed a special package that included a theater ticket, a night at a hotel or a restaurant, and an admission ticket to either the Ontario Science Centre, the Royal Ontario Museum, or the Art Gallery of Ontario. And it was, I think the price points were $99 and $129. They were very inexpensive. And lots of people grabbed those. Lots of out-of-town visitors. It was only available if you lived outside Toronto. And that proved very, very popular. So on that, someone like the Ontario Science Centre was not the prime provider. It was definitely a loss leader for us because we were not getting a full ticket price, but we were getting people back. The city was getting people back. And really on all of the initiatives that came out of Toronto 03, it was about everyone working together to get people back into our city. We knew our city was safe, and we wanted other people to know that too, and to make the summer and fall in Toronto in 2003 an irresistible offering.
It was also a major marketing effort on behalf of the province and the federal governments to the tune of probably $200 million in Canadian, so half of that.
75%.
Yes, 75%. But that was a real effort to try and communicate that we were open for business, and that not only for people coming into the city, but also people in the city to remember to come and use the institutions that existed there.
So I wanted to build on that because this came up in some of our prep conversations as well. We've talked a lot about tourism. Tourism was very important, still is very important in Toronto, but that's not true for everybody. It's certainly here for me in Calgary. Tourism is important as people come, but they go through to the mountains and trying to capture them, but the numbers are still pretty low. So if we flip it around and think about commitment and confidence in our community, one of those areas that's been very hard hit, very close to home for me because my son is in that industry, is the restaurant business. So I think that there's an opportunity, again, for Alliance focused on building the community confidence in those sorts of things as opposed to necessary. So take some pattern off what happened with the tourism work that Lesley was involved with for all of Toronto, and think about relaying that back into a more local environment. I think there's some really good matches there.
Interesting. It makes me wonder whether some of the places in the US that have been most famously hotspots for COVID, like Seattle and San Francisco, New York City, are going to launch joint marketing efforts for the city to try and make people feel comfortable coming back, and what role cultural organizations might play in that. We have a number of questions about how the center might have changed its public programming in response to SARS. Specifically, did you do any public education about the virus and epidemiology and the public health response?
So we didn't at that particular point, because we didn't have the mechanism by which to do that. There was already a very powerful spokeswoman in the city who was the face of SARS. And so making it clear that we had some conversations about this. We didn't want to get in the middle of what was happening there and in any way derail the public health messages that needed to come out. Because just like COVID, we were trying to understand what was happening epidemiologically and scientifically, biologically, as this thing was unfolding. When we considered SARS later on, we built, and we were building a couple of other things for the Science Center, we decided to use that as a way of thinking about how do you communicate ongoing current breaking news in a science center. And so there was a space dedicated to that. I believe it's still operational, that continues to update people as they come into the building around the current science issues. I would suggest that it's a great opportunity for institutions to think about what role do you need to play, or can you play in your community in that? And that somebody else isn't doing that and you're not undermining whatever concerns that might be coming out from public health.
I think also on that note that this is clearly, the tail is going to be a lot longer on this than it was with SARS. We had more of a cliff drop. It got finished. It got isolated into the hospital system, which was tragic in many ways, but then that was it. We're not seeing that cliff drop here, I don't think. And so I think there's a growing opportunity to Julie's point, having a mechanism to do public programming, stand on a stage, deliver the news of the day is a very important tool to have. But even if you don't have it, I think that our museums are becoming more comfortable, and the technology of doing quick, prints of things and tacking up paper is a really important role for us as this takes longer to help diffuse some of the real lack of understanding. There's so much misinformation, and yet we do still have a major place of trust with our community. So I think being responsive is a very important thing, because the public health message has been well taken care of. It's all the other stuff in between that's a mess. I think we've got a very big and opportune role to fit that gap.
That's a great point.
And speaking of alliances, I think it's really important that museums not think that they have to each do that on their own. Work together. The reality is that the public across the United States, across Canada, need to be aware of things that are in addition to that public health message. And if there is, as everybody suggests, the risk of a very major second wave, then what are science museums, what are regular museums, what are art galleries doing during the interim period when they'll be reopened? How can they help communities be more prepared, be more resilient?
I'm glad you brought that up, because much of the dialogue I see right now, people are so focused on reopening after this first wave, when they need to be aware there may not only just be a second wave, but repeated waves until we figure out what the pattern is, until there's an effective vaccine for COVID. As a matter of fact, one person had asked, I noticed earlier in the queue, whether you remember whether people sort of were on tenterhooks worrying that there would be a third wave of SARS. So after the second wave, was there this sort of residual fear and anxiety?
So there was an interesting situation that developed around SARS, where the second wave was restricted to the health system, and the health professionals were becoming so exhausted that having that happen to them was in some ways catastrophic. And so I think there's an opportunity there to think about what that looks like and what do you do.
Mm-hmm. So we have 10 minutes left, and I want to use that opportunity to pick some of the questions that are inviting you to sort of apply in a more general way what you learned from SARS to the current situation, and sharing your imaginings of how this may play out. First of all, one question was, do you really feel, and this is starting more in the past, do you feel that things pretty much went, quote, back to normal after SARS at the museum, or were there at that time any permanent impacts that changed your operations? And then comparing that today, do you personally imagine that there are things that may reset in fundamental ways for the long term?
You know, my reflection on that back to normal is that it didn't happen. The Ontario Science Centre did okay. Our attendance recovered, but the whole city was sunk for, it felt, Julie may have the follow-up data, but it felt like 3 years or more that the city had lost energy and volume. And it was a very long, slow recovery. So while we busied ourselves with the work of the Science Center and the museum, and we had a capital campaign at the time that was circumstantially underway anyway, we had lots to do. The tourism market was important, still is important to the Ontario Science Center, but you know, we kind of managed while that happened. But I was constantly aware of how the city was just not where it used to be.
Julie or Lesley, do you want to weigh in on that, or should I move on?
My answer was going to be much more trite than Jennifer's, I'm afraid. Because in terms of, I would agree with what Jennifer's saying about the city took a while to get its sense of self back. But in terms of the Science Center, almost the only longer term impact that I remember is that we left the hand sanitation stations out on the floor, and we were ahead of the curve. I mean, by 5 years later, everybody had them all over the place, but they were very visible on our floor. But I don't recall it impacting the way we thought about our business, either strategically or on a day-to-day basis. Julie, how about you?
The thing that I would reflect on from what happened with the strike and then SARS and the blackout and then, you know, whatever, the disasters mounted at that point, was the resilience of the staff to come back and to be creative and to respond to the situations as they unfolded. And I think if COVID can teach us anything, it's about how to build resilient communities and how our science centers and museums can become, some of them can become more important in terms of that, that building of resilience. And so what does that look like? I think that's the question that I would pose back to you all. What does a resilient community look like? And then how does your museum or science center or children's museum interlace with that? And who are the partners that will help you to do that in a way that makes your community, because it may be that everybody contracts around the local at this stage and people don't travel as much, which is what we saw with SARS. There wasn't the big numbers of people coming into the city. And so what did that mean? We had to rethink who we were there for. And so a lot of the exhibitions that we built from that point on were really thinking about what's our local audience interested in, not what's our tourist audience interested in. Not the big blockbusters, but what are the things that we can do for families that are looking for something. And so again, that resilience of community that becoming a hub for your community, or becoming a trusted source, or building on those things, those qualities you already have, would be my hope for all of you.
So, and to build on that from an internal perspective, I happen to have Duhigg's Smarter, Faster, Better book on my desk, and I was looking at the teams part of it the other day. He quotes somebody who talks about 5 key things that teams need to have. And to the point of resilience, first, teams need to believe that their work is important. Well, never was a better time to be thinking about how important we can, how importantly the role we can play in the community is. They need to feel their work is personally meaningful. And I think that COVID has certainly touched everybody personally in some fashion. So linking those two, I think, is pretty clear. But at the same time, they need clear goals and defined roles. So what are we trying to achieve, and who's doing what? His fourth is team members need to know they can depend on each other. So back to how does it feel to be back to work and working together? And then the most important, and it's a much deeper conversation, but is the psychological safety of being able to speak, feel like you're being heard, working together even when differences amount. So, it brought me back to really thinking we are the people making these changes. How do we work together? And how to remember as leaders what the key things are that are really important for us to move forward.
That's wonderful advice. Several people have commented that one thing that's very different about dealing with the coronavirus crisis and dealing with SARS is that 20 years ago, social media was not a thing. So you had much more literally limited bandwidth for communicating in a digital manner with your audiences, both to get feedback or share what you were doing. How do you feel that's changed the tenor of what museums can do or should do in responding to this crisis?
Well, it seems to me that one of the things museums can do is to be a voice of reason. We haven't, certainly in Ontario, we haven't seen the same kinds of differing perspectives that I'm seeing in the US media about COVID. But I think if I was, for the most part, our leadership is coming from the public health authorities and from politicians who remarkably are working really well together at the national and the provincial and the city levels, people who don't necessarily always work well together. But I would think that for many Americans, there's probably a lot of confusion in terms of who they should believe and what they should do. And I think that one of the phrases I've always liked about science centers is that we can be safe places for difficult conversations. And I think that museums can play that role the same way that science centers do. We are trusted. We know that the research says that. And so let's be there. It's a difficult conversation that everybody's having right now about the changes that have come in our lives. And social media is exacerbating the divisions between people. Let's see what role museums can play to help people understand, to be science-based.
That is a wonderful and uplifting note on which to end this webinar. So I think I'll stop there. We're at time. I want to thank you very much, Lesley, Julie, and Jennifer, for joining us today and sharing your experience. I really think that by learning from what you went through, our large audience is going to be able to feel a little more comfortable in crafting their own response to the current crisis. So to all of you out there, we are recording this webinar. It will take us a little while to clean up the transcript, but we'll be publishing it to the Alliance blogs. So be safe, be sane, and I hope that you are well in your own lives and in your organizations. So take care. Thank you very much for joining us today.